So we are here in Clacton on Sea, and so we are going to be meeting with Lord Patel and the Breaking Barriers team, with whom we are partnering to take forward some community-based projects to explore the opportunities of using employment as a very powerful vehicle to support people struggling with mental health challenges.
They struggle to access the services. It's very complicated for people.
So the summit is a mental health advocacy organization.
Yes. But you've also got to remember that return is going to be different for every person.
Yes.
The return that I've got from Nick and meeting everyone through this is different to what Kevin's got in return, it's different to what Ricky's got. So you can't box anything.
We've been listening to Kevin, to Bob, and also to Ricky. They are three people from this local community who have experienced different challenges ranging from homelessness, mental health difficulties, and how they've been supported. The walk and talk service is part of the support offer. So we're going to do a walk and talk to listen to Tanya's story.
Think about all your amazing successes that you've done since really, over the year?
How often do you go on your choir?
Well, I mean, once a week on a Wednesday.
Is that in the day?
In the day, in the morning.
Okay. So what you got planned for the rest of the day?
Not quite sure yet. Probably. I've got to go to college. Yeah, interesting it is.
Is it?
Yeah.
And before you started, working with Shona and colleagues in the summit, tell me, what are things like for you? What was it like?
Okay,
What was?
right. It's okay.
Oh,
it's all right.
bless
It's okay.
you.
It's okay.
Oh.
It's all right. It's okay. What do we always say? Sometimes it's healthy, isn't it? Yeah. It's our body's response, and it's okay. And I tell you what's going to happen. By the time we've got to that Wheel of Fortune, and we're back, you'll be laughing.
Yeah. Oh, look. So we know that healthcare inequalities are driven by the wider determinants of health. Education, employment, income, housing. These are the big drivers of health inequalities.
Yeah, this way, Brian? Yeah. So we've got the computer over here. Brian's looking to see if there's any work opportunities.
I wish I did have internet, but I haven't got internet.
No.
For interviews and for things like fixing up people with computers, because when you're on your own, it's not so easy.
So I'm going to set you up with a basic email account. So you'll be able to log in now when you go, if you're searching for a job or a volunteering opportunity, or to see what's on in anything really that you sign up for. Now you need an email address, so you've got that, so that's really good.
All this time, despite having a pandemic, things have kept moving, and I think things have kept moving because of the people around this table, and others have joined in.
A lot of people want to work locally, who live locally, and therefore the importance of bringing jobs here is really fundamental.
I think it would be great to explore what those opportunities are, because what you're saying there is creating the conditions locally for high quality jobs.
I mean, we're talking about jobs, employment, we're talking about infrastructure because of health.
Yeah.
We don't do that. Health never talks about jobs, infrastructure. It mends ill people.
I think what we've absolutely confirmed today is that employment as a wider determinant of health is a powerful contributor to health inequalities if it is lacking. And so to have people in the room today from the NHS, from the construction industry and other industries in the same room, having a conversation about how do we create employment opportunities, apprenticeships, how do we map the routes into employment and find the barriers along each one of those routes and take collective action to remove those barriers, because we see now the role and the contribution that good employment, work experience, apprenticeships, the contribution all of that can make, not just in terms of income, but absolutely addressing health inequalities and improving people's health overall.